We are talking leaks today, and no, I'm not talking about that lovely gigantic onion or signal gate.
That's right, we are going with the flow as we discuss urinary issues right here on Everybody Knows.
Welcome to Everybody Knows Season 2. My name is Mike Kasem.
And I'm Catherine Robert, and today we discuss a topic that many find difficult to discuss with friends.
It's true. I mean, you might tell someone, look, I've got the flu, not feeling so great, because you're very less likely to say, I've got a urinary tract infection. I'm going to stay home today.
You know what, Mike? Nobody says it like that.
I was like, I have incontinence, Cat.
Now, if you think you have either condition but haven't gone to seek help, well, take the first step with us as we consult our urology expert. Let's welcome Dr. Fiona Wu.
Welcome. Welcome.
Welcome to the show. Wow, we are talking about some interesting topics today.
Yes, we are. This is a good topic. This is an important topic.
Catherine, nice to meet you.
Because I think everybody here pees, right?
Yeah. What a question.
So this is a topic that we can all get along with.
Yep. You know what, Dr. Fiona, I think we're going to start with UTI first. Now, I want to know, I saw an NUH statistic that women are 30 times more likely than men to get it in their lifetime. Now, why is this the case?
Because anatomically we are different.
Okay.
The female urethra is very short compared to the guys. It's only about 3 to 4 cm usually. For the guy, it's almost 16 cm.
16?
It's 4 times
wow.
our length.
So it's bigger is better when it comes to urinary tract.
Yeah, for sure. For the guys, right, the urethra, which is at the penis, is further away from the anus as well. So for most of the infections that the females get, it's usually from the gut. You want it to be away. Whereas for the female anatomy, right, the urethra is short, and also the distance from the anus is much nearer.
Okay.
So that's why we have it more often.
Do you see a lot of UTI in men or more incontinence in men?
Definitely urinary issues in men rather than urinary tract infection for guys.
Okay.
Is it, when you get it, is it worse for men or worse for women?
I think it's bad for everybody, but it's worse for the guys. The guys will come and see the urologist earlier.
I don't know if I've ever had one. If I had one,
would you know?
What would happen?
You will get burning sensation when you pee. You have the urge to pee.
I've had that before for like a day or two. Would it go away on its own, or would I have had to go to...
If your immune system is good, then it usually may resolve by itself.
Okay, so maybe I had one.
You can't tell.
Are you saying that your immune system is good?
I hope so. I mean, I don't know. But I mean, I remember there was like a 1 or 2 day period. I was like, why is it hurting so much when I'm going to the bathroom? Is that that's an infection then?
Yes, but that's probably an infection.
Okay.
But for the guys, not for you, there may be other reasons. For example, prostatitis, when they have inflamed prostate, whether it's bacteria or not, they will have the same symptoms such as burning, the urgency to pee, abdominal pain, which are very non-specific sometimes. And also, right, there's another entity called sexually transmitted disease.
Right.
Which may present with similar symptoms.
Okay.
And also with some discharge from the genitals.
Okay. Well, we've got some guests today joining us, and they are itching to ask some questions today.
Goodness. Puns all day today, I guess, but it's okay. Big welcome to our gorgeous celebrities, Azura Goh, DJ from Ria 897, and model and actress Sheila Sim.
All righty, come on out. Hello.
Oh, gorgeous.
I mean, I see Azura every day, but welcome to the show.
Thank you.
Hi, Sheila.
Thank you. Hi.
All right, let's take a seat. Now, welcome to the show. You know, this is going to come across and sound really weird, but I know all about Azura's UTI. I know all about it, and I know how much she went through. You were hospitalized. Now, tell us a bit more about how it all began.
The first time it got really bad was in 2018. And since then, I've been to the hospital every year. Basically, my UTI is almost daily to the point that I can't tell when I need to do something about it. And then every time I've ended up in the hospital, it's because it's traveled up to become a kidney infection.
Oh my goodness.
Oh
I
yeah,
have no
Mike.
idea what we're
I'm
in
sorry.
for here.
Yeah, you had no idea this background. No.
No, I crowned myself the UTI queen.
Not sure anybody wants that crown, but okay, Ken.
So it's not something that just, okay, fix it, done. So this is something you live with.
I have been okay for like a year now. So it's been great. But before this, it's been hard.
Okay, so what was the process of getting better?
The last time I was in the hospital, which was last year, that was when it got really bad. And because I had become resistant to a lot of antibiotics as well. So a lot of the stuff that I could take had to be dripped in and not oral. And after that, they followed up with like 4 months of low dosage antibiotics. So I think that sort of cleared me up a little bit. But it came to a point where, because I had been asking to see a specialist, like Dr. Fiona, and eventually when I did, they tried to check for like an overactive bladder, a urine backflow, but those were not present. So we couldn't really tell why I was having so much issues with it.
That's the worst when you don't know why. Yeah.
So I'm sure you have so many questions for Dr. Fiona. Does it always get to a kidney infection, or how often does that happen?
That's not very often, you know.
Wow.
Poor Azura has it
Oh, I'm
bad.
the lucky one.
Oh my God. She has it bad because if our immune system is quite good, it usually stops at the urethra, like at the bladder.
Right.
And seldom it goes up to the kidneys, which is what she went through. And we did all the investigations for her. Like what she says, we need to check and see whether it's some pre-existing anatomy abnormality. For example, reflux, which means that the urine, it goes back into the kidneys after it comes out into the bladder.
Oh,
That's
man.
not good.
Yeah.
And of course, there are some patients, they have some undiagnosed problems, congenital, meaning that when they're born, their kidneys, their bladder, there may be some issues already.
What a horrible thing to have to go through. How many years?
2018, that was when it first started, the
Okay.
first kidney infection.
Okay.
And then...
But you
I-
had UTIs before that, but they didn't get turned
Yeah,
into...
and not as often as well.
Do the doctors tell you about like lifestyle and like maybe just eat super crazy healthy and drink the green juices and try and like...
No, so I think they always tell you things like, oh, you gotta wash, you gotta watch your hygiene, you've gotta pee after sex. That's what they always tell you.
Yeah.
And that's a thing that everybody knows,
But I'm sure
right?
you do that, right?
Yeah, and I was extremely like particular of all of it. So
Yeah.
So then, doctor, could you please tell us, like, what are some of the possibilities that...
Why?
The intensity and the frequency of it.
One common cause, right, is inadequate water intake, dehydration.
So here, that's the thing, right? It was so mind-boggling. Just as a friend who watched it from the sidelines, she always has a water bottle, and she's always like, yeah, glug, 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 glug. And I'm just like, how are you getting UTI, and how is it getting so bad?
Do you hold back your urine, Azura?
Oh, no,
Toilet
no,
break?
because I need to pee every like half an hour. Even when I don't drink as much, I think I'm still going like pretty often.
The other reason are things like menopausal or perimenopausal.
There's
Some
no
people
way
don't
that's
get it.
happening to you.
No, she's nowhere near there. I'm
What's
sure.
happening?
Then other reasons are like after intercourse.
Can I check?
Yeah.
Like after intercourse, if you don't pee, does that increase the rate of UTI?
Not really, you know. Sometimes I think the studies are contradictory on that, you know. They are not very conclusive.
I've heard this one, that you can get a UTI from a dirty toilet seat. Doctor, just tell me whether that's true or false.
I don't think it's true.
It's not true.
I don't think it's true.
Unless you like rub on it or something like that.
Just, I need to pee. You start rubbing,
Because
is
it's on your leg.
Cleaning from the back to front, I mean, that's definitely one of it, right?
Yeah, that's
front
none of it.
to
But
back.
there's something that I must say that I think people tend to overclean.
Is that a thing? What
is that?
you
Using
overclean
a
and
douche
then
or-
you... Yeah, no, if you overclean, are you then more prone to UTIs?
It's not good, you know. It tends to get really dry there. Then when there's a protective layer usually, you know, for the females. That's why you have discharge and stuff.
Right.
So it's actually to protect us. So basically, I just tell patients, you can just gently clean it with a soft tissue. You just gently tap it.
Okay, another thing that I remember Azura having done when she had UTIs was she started drinking cranberry juice.
Yes.
So actually, right, what I found really helped me
Yes.
were the high active or high action cranberry pills.
Yeah, because you need a high dose. And actually, for myself, right, usually I would give probiotics rather than...
Correct.
cranberry.
That helped me too.
Yeah, the probiotics help for real.
Now, does it ever get so bad to a point that you have to do an ultrasound for UTIs?
For Azura's case, I think she has too, because it has already gone up to the kidneys.
Okay.
And for some patients, right, the infection is so bad, they actually bleed. So for those cases, we need to scan the bladder as well to see whether there's any issues there.
Doctor, now if you've had UTI once, is it more likely to become a recurring thing?
No, you know, it depends on what's the real cause. For example, one of the most common cause in the young ladies would be after intercourse. So it can recur because it happens.
Okay. So after intercourse, what should a woman do?
I guess what Azura said just now, just drink a lot of water, go to the toilet, And sometimes, instead of long-term antibiotics that she was on, I would recommend that the patients take one antibiotic after intercourse. That's for prevention. So that you don't keep getting it. You don't have to have this long course of antibiotics. Because the moment you stop it, the infection comes back.
Is it caused by the partner or is it caused by the woman themselves?
Okay, I feel that it's not really due to the partner. A simple reason is because if they change partners, right, they still have it. And usually the bacteria comes from our own gut.
Okay.
Is there a UTI vaccine?
Yeah, there is one.
There is?
No one offered me.
Yeah.
Because you are not eligible for it anymore.
Dr. Fiona's UTI prevention. Hydrate regularly, take probiotics, and consider the UTI vaccination. Wow, okay.
Is it a yearly thing or is it
No.
like a once in a
Okay.
lifetime?
It's an oral medication that you spray underneath the tongue for 3 months though.
3 months straight,
Every
every
day.
day.
Yeah, and
then-
night before you go to bed.
Good for how long?
Good for about 1 over a year. But if you don't have issues, you don't have to keep taking it. But for people with recurrent serious problem like hers, I think it's worth it. Because if you keep getting kidney infections, right, eventually the kidney may get scarred and the function may be affected. So that's the problem.
Okay, please go and buy the spray.
Yeah, okay.
My goodness. All right, guys, listen, it's time for us to take a break. I'm learning more on this show than I think most of the shows. When we come back, we're going to be talking about another urinary issue. So if you've ever suffered from incontinence, stay with us on Everybody Knows. Welcome back to Everybody Knows. And if you've ever had urinary incontinence, you would know how embarrassing it feels. But the condition is actually more common than you think.
That's right. In Singapore, around 10 to 40% of the population suffer from some form of incontinence. Annie was one of them, and the former cabin crew member decided to seek help.
Hi, I'm Annie. I'm 50 this year. I work as an executive, and as I age, I'm actually experiencing issues of incontinence. First time it happened to me was when I was doing my HIIT exercises. So I was in the gym, so it's during the sets where I was doing a skipping rope. When I was skipping, I actually felt that my pee is actually leaking. So I was a bit shocked. Yeah, and I literally had to stop what I was doing and went to the toilet, clean up myself and also trying to get over the shock of what happened. There was a few incidents actually where I was out the whole day and I didn't go to the toilet at all. So when I was reaching home towards the end of the day, I had this sudden urge that I really need to pee. But it's so bad that I actually find that I couldn't hold my pee. So I was literally leaking all the way from my main door to my toilet. It's just that my bladder has got no sensation. Like other people will know it's full, yeah, but mine doesn't because we have trained it so well that, it got no sensation that it's full. Because I used to fly for 12 years as a cabin crew, so our duties are actually very busy, and many a times we hold our pee. Last time, my family and friends, when they go to the toilet, I would just say that, it's okay, you guys go ahead, I'll wait here. Thinking that it's actually an art of being able to hold my pee for the whole day, but I realized that actually it's not a very good habit to have, yes. So you need to actually make an effort to, even though you don't feel like it, but it's good to at least go. Yeah, midday, you have to at least go. Every 3 hours, you have to go.
What Annie is experiencing is called disturbance of the voiding cycle, also known as voiding dysfunction. It's a condition that affects the natural process of urination, everything from filling and storing urine to emptying the bladder. This can show up in many ways: difficulty starting to urinate, slow or weak flow, a feeling of incomplete emptying, or even the need to strain just to relieve herself. For Annie, it's more than just a physical challenge, it's a daily struggle.
I didn't think that it's so serious as in I need to seek medical advice. Yeah, but I do have doctor friends, so I spoke to Dr. Fiona. She actually gave me a set of advice, for example, doing certain exercise that will help me to strengthen the muscles. Squats is one of them, and then wall sit is one of them. And Kegel exercises, yeah, where we actually use, the set of muscles that actually control the flow and the stoppage of the pee. Basically, it's like just contracting that muscles for 3 seconds, just relaxing it for 3 seconds, and do it over like 10 sets. And try to do it like 3 times a day, if possible. Although I would say that I'm not that conscientious, but sometimes my family members will actually try to remind me, You know, when they don't see me doing anything, they will just say, "Mommy, can you please remember to go and do these exercises?" Yeah, because she has witnessed what happened to me. Over time, I see less incidents of such things happening, and it's been a while, like 6 months since the last accident happened. I hear my friends sharing with me also, because I think for ladies, especially after childbirth, especially you have given birth before, yeah, as we age, I think we will see more incidents of incontinence. So I think it's good to, before it even happens, to start exercising the right set of muscles.
Wow. She mentioned that, you know, it was a lot to do with holding her pee, and she also was a former cabin crew. Us radio DJs, Doctor, we hold our pee quite a bit too, because, you know, we've got certain points that we have to go on air. Do you think we're more likely to?
Usually it happens to people like the cabin crew, to doctors, to nurses, to DJs. So I think when people hold their pee for long, they tend to over-distend the bladder for many years, right? So basically the sensation is not so good and the sphincter becomes tight.
Oh.
So as time goes by, as we age, right, they realize that the bladder is too weak.
So we're not getting
pee.
better lah.
Yeah.
As we hold our pee. We do always feel like, okay, I can hold it better now because, you know, I can do more things, but it's not.
It's over-holding. It's not so much of a usual kind of regulated kind of peeing.
I always had to go toilet very often, and I have I feel like it's an inability to be able to hold the pee. And then the irony is this happened before I gave birth.
Right.
Because I later realized that I had so much fibroids in my womb that it had grown in places that apparently had pushed towards the bladder. And therefore, I was always feeling very urgent all the time. So when I removed that, I can now hold my pee so much better.
Dr. Fiona, I've got a question for you now. Are there different types of incontinence?
Yes, for sure. For example, there's stress incontinence. That's when any increase in the intra-abdominal pressure, for example, laughing, sneezing, or even exercising, you tend to leak.
Okay.
Then there is also urge incontinence, which was what Sheila was experiencing. She suddenly feel urgent, and before you reach the toilet, it may come out already, the urine. And then for the elderly, there's overflow incontinence, whereby the bladder muscles really don't work well. So whenever the bladder is full, right, they tend to leak out. Mixed just means that usually there's a combination of both stress and urge. Functional, basically, sometimes it's just like, we can't tell what's the reason.
Right.
For the kids, right, sometimes it's a bit of functional issues. When they're growing up, they don't know how to pee properly and stuff like that. Then they tend to leak a bit.
Which type of incontinence would you say, you know, that you see most often?
I would say that the urge is the most common, followed by stress.
I know someone like that who needs to pee all the time, a male, by the way. And actually, the doctors told him you can't give in to it all the time. And you need to hold it.
It depends on how you look at it. Because I do tell patients they need to train it, but after I've at least sorted out the problems, at least you don't feel the urge, then you can train it.
Annie was talking about pelvic floor exercises. And of course, as a doctor, there's also medication. What if both don't work? Then how? Is surgery a thing?
Surgery is more towards stress incontinence rather than urge incontinence. For urge incontinence, right, we tend to do things like medications, lifestyle changes, and if nothing really works right, then we have to do more invasive procedures, for example, Botox injections into the bladder to calm down the bladder. It also relaxes the bladder.
What's the downside of that?
For the elderly, right, the bladders are not so strong. So if we really
it's
do
too
need...
relaxed,
Yeah, it's too relaxed and you can't pee.
I see,
That's
I
bad.
see.
Okay.
What about this laser therapy?
There's a new experimental treatment for stress incontinence, whereby we use laser inside the vagina. We make the tissue a bit thicker so that it can hold better. Something similar to the laser that we do to our face. It actually builds up the collagen, but it's not permanent.
Okay.
So it seems like there's a lot of options here. So tibial nerve stimulation.
Tibial nerve stimulation is for urge incontinence. Like you keep wanting to pee or the bladder muscles are overactive and the medications don't really help. Then we have to stimulate the nerve at the ankle.
Take notes, huh?
Sorry, just now you said medication. So what does the medication do to minimize or to cut down the amount of pee or what?
No, the medications actually relaxes the bladder so that you can hold a bit better. You don't feel this strong urge to pee at all times.
Okay. All right, and for the final one, SUI surgery. Tell us a bit more about that.
Okay, for some patients, right, the pelvic floor exercises don't really work. They really leak badly, especially when they do a lot of exercises like HIIT. So they want a permanent treatment. Then we have to do a surgery for them.
Okay.
We make a small cut, and then we put this
Small cut.
a small kind of vagina, and then we put this sling. This is the actual product itself.
This goes in?
Yeah, this goes in, not this thing itself, only the tape itself. So this is the mesh that you actually see. This is for the coming out of the tape. So it actually goes underneath the urethra. It comes out from the thigh, and then it actually lifts it up. So all these meshes, right, it stays there by fibrosis. It then, the tissue in our body will actually integrate it in.
So how long does that take to do that? That like right away or?
Usually it takes about a few weeks.
For the body to
To integrate
do
it
its
in.
thing, yeah.
And it lasts for a long time?
It lasts for, it's a permanent, we don't take it out, unless there's some issues with it.
Are there any side effects to this?
One of the side effects is...
The
as
fishing net comes out.
Because
it comes out?
Yeah, because the vagina gets very thin and it comes out a bit. So at that time we have to remove it, but that's not very common.
I'm very stressed.
I'm sure you do real things. Are you
Captain Nick's like, I got this, don't worry, ladies. My goodness.
Oh, yeah.
Oh my
goodness.
gosh, the kind of
This
thing you
is
have to experience.
absolutely stressing me out. But you know what? I need to pee. This whole thing is making me want to pee and making me stressed. Time for us to go for a short break. But when we come back, we've got a pop quiz for our guests. Don't go anywhere.
Welcome back to Everybody Knows, where we bring you an insight into some of the most common medical issues.
Now, before we ask Dr. Fiona about the exercises, we have a game for our guests.
We're going to give you a diagram of a woman's midsection, and all you have to do is identify 4 elements: the pelvic floor, the bladder, the bowel, and the uterus.
Mike, I hope you guys were paying attention to Dr. Fiona because they are giving us a generous 1 minute. Now, Dr. Fiona, you are the game master, so we're going to
Yes.
take your cue.
Okay. Okay, ready? Starts now.
Okay, review the boards. Wait, the 1 minute started already?
Yes.
Oh, okay.
Okay,
Hey,
so
you saw a lot of x-rays, right?
this is the bladder, this is the bladder.
This is
Hold
the
on.
bladder.
This one, huh?
Yeah.
Hey.
Auntie! Ayo!
Okay. Are you sure?
Oh my God. What is she doing? She's tearing the paper!
Okay, go.
Okay.
Pelvic floor.
This?
Yeah, I think we got it.
Right.
Yeah, okay, yeah, got it.
No.
We are done. We are done. We are
3, 2,
done.
1, we are done.
Why
We
take
are
so
done.
long?
So we're just trying
Why
to get
take
it
so
stopped.
long?
Okay, so doctor, we got it all right.
Yes,
We all
started
Bladder,
it.
right? Uterus.
Well done.
All right, Dr. Fiona, you know, I was hoping that you would talk us through some of the pelvic floor exercises.
So the pelvic floor muscles are there to control our poop and pee. So how we exercise it is find a comfortable position first, and then you must identify the correct muscles. So I think the easiest way is to contract the pelvic muscles when you are peeing. If you do it correctly, the pee should stop.
All right, so that's
Yes.
what you have to do in 10 to 15 times in each set and 3 sets a day.
Yes.
Well, thank you guys so much for being here. Azura, Sheila, you guys were awesome. And Dr. Fiona, we can't thank you enough.
Absolutely. I'll be keeping your advice in mind, no doubt about it. Azura, please take her number as
We
soon
hope
as
you guys
possible.
enjoyed watching Everybody Knows, and we'll see you next week.
Bye-bye.